Yesterday, the government's expert advisory group published a report on the challenges this autumn and winter. They were asked to do so by the government's Office for Science. That report assessed the reasonable worst-case scenario for this autumn and winter, including a second COVID spike and seasonal flu, and it set out strong recommended actions to mitigate the risks. The report was clear. July and August must be a period of intense preparation, i.e. now. Can the Prime Minister make clear that he intends to implement the recommended actions in this report in full and at speed?
Prime Minister, not only are we getting on with implementing the preparations for a potential new spike, but he will know that the government is engaged in record investments in the NHS, £34 billion. What I think the House may not realise is just in the last year since this government has been in office, there are now 12,000 more nurses in the NHS, 6,000 more doctors, and it was thanks to their hard work, thanks to the hard work of the entire NHS, that we were able to prevent our health service from being overwhelmed this spring, and we will take steps to ensure that it is not overwhelmed this winter as well.
That's the whole point of this report. It sets out the reasonable worst-case scenario and tells the government what it needs to do about it. So I'm surprised he's not committing to fully implement it. It's vital that the government learns the lessons from the mistakes that have been made and acts now to save lives for the future. One of the key recommendations in this report, commissioned by the government's Office for Science, is that testing and tracing capacity will need to be significantly expanded to cope with increased demands over the winter. The reality is this: trace and track is not working as promised as it stands today. The report makes clear it needs to be significantly expanded to cope with the risks of autumn and winter. What assurance can the Prime Minister give that the system will be fit for both purposes in the timeframe envisaged in this report, i.e. by this September?
Prime Minister. Mr. Speaker, once again he attacks the test and trace operation, which is working at absolutely unprecedented scale, and 144,000 people across the country, have now agreed to self-isolate to stop the spread of the virus. He keeps saying that the test and trace operation is failing to contact enough people or failing to get enough people to self-isolate. Actually, they are doing fantastic work. 70% or 80% of the contacts are found, and they are getting through to the vast majority of people who have the disease. And I can certainly give the House the assurance that our test and trace system is as good as or better than any other system anywhere in the world. And yes, it will play a vital part in ensuring that we do not have a second spike this winter.
Keir Starmer.
Mr. Speaker, the problem with the Prime Minister quoting the 70% of people who are contacted and asked to self-isolate is that's gone down. It was 90% just a few weeks ago, and every week it's gone down. So I wouldn't quote the latest figure, looking at the trend. But I have to ask, in light of the last few questions, has the Prime Minister actually read this report that sets out the reasonable worst-case scenario and tells the government what it needs to do about it in the next 6 weeks? Has he read it?
Prime Minister.
Mr. Speaker, I'm of course aware of the report, and we are of course taking every reasonable step to prepare this country for a second spike. And I may say to the right honourable gentleman, it is up to him really to get behind what the government is doing or not.
Keir Starmer.
It is perfectly possible to support track and trace and point out the problems. And standing up every week saying it's a stunning success is kidding no one. That isn't giving people confidence in the system. They would like the Prime Minister who stands up and says, there are problems, and this is what I'm going to do about them. Not this rhetoric about stunning success when it's obviously not true. Finally, this afternoon, Prime Minister...
One day he says it's safe to go back to school. The next day he's taking the line of the unions. One day they're supporting our economic programme. The next day they're saying our stamp duty cut is an unacceptable bung. One day they're saying they accept the result of the Brexit referendum. The next day, today, they're going to tell their troops to do the exact opposite. He needs to make up his mind which brief he's going to take today. Because at the moment, Mr. Speaker, looks he's got more briefs than Calvin Klein. We're getting on with delivering on our agenda for the country, getting this country through this pandemic and taking it forward.
Can I just say to the Prime Minister as well, we are going to work through the chair.
We're not, the audience isn't that way, it's this way. Rob Butler.
Mr. Speaker, under this Prime Minister, we've suffered one of the worst death rates. If he still rejects an immediate inquiry, will he instead commit, in principle, to a future public inquiry? Yes or no?
Prime Minister.
Mr. Speaker, as I've told the House several times, I do not believe that now, in the middle of combating, still as we are, a pandemic, is the right moment to devote huge amounts of official time to an inquiry. But of course, Mr. Speaker, we will seek to learn the lessons of this pandemic in the future, and certainly we will have an independent inquiry into what happened.
Now head to Yorkshire and visit Nuz Shah. Nuz Shah.